Hi, everybody. It's Helen Hillix from My Heart to Yours, and I am so excited today to have Dr. Brooke Stuart as my guest. And I'll tell you all about what an exciting person she is and the great work that she's doing in just a few minutes. But I want to talk first of all about the whole topic of mind, body, spirit healing and why it's so amazingly important to our whole world. Because we can think of things with our minds, or we can react from our bodies, or we can react from our emotions. But if we don't realize how it's all intertwined and integrated, we are not going to be ever reaching our potential, either as individuals or as a society. So I love Brooke's work in that she is bringing to us this awareness that we get to remember to treat ourselves holistically. And that is a huge movement. I mean, she'll tell you more about that, I'm sure, about how much holistic treatment has increased in the past decade since she's been doing this work. And I am a huge advocate of it because we need that so much in order to heal the human heart, to heal the human consciousness, and heal the human body so that we can all have the happy, peaceful lives we want. And that's what this podcast is all about, is connecting to people who hold that vision of supporting the whole world to be different. And it starts with each individual. So I'll tell you a little bit about Brooke, and then she can say hi and we'll get on to her story. Brooke Stuart is the creator of Let Go and Grow program, which is and she's also a holistic doctor in private practice. Over the past 10 years, Dr. Stuart has worked with thousands of people through her online platform, speaking engagements, and one-on-one practice in her private practice, holding degrees in medical anthropology, psychology, Eastern and integrative medicine. Dr. Stuart, I'm going to say, is brilliant, and she uses a unique combination of holistic counseling and functional medicine to personalize and tailor treatments for helping her patients, particularly women and professional athletes. And she's located in Maitland, Florida. And she also helps people around the world because of the wonders of video conferencing now. She can reach people that she never would be able to and impact people all over the world. As a physician, she's deeply committed to her patients' personal growth and development as she uses solution-oriented methods to clear issues, create health, and assist them in realizing and actualizing their true potential. So I want to welcome you with an open heart and open arms today, Brooke. And I'd like you to introduce yourself and to tell us how you got into this fabulous business.
Oh my gosh. Thank you so much for having me, Helen. I feel it's such a privilege to be here and to be able to do this kind of work. And to be honest, I never would have thought I would be in the medical field whatsoever, because growing up, medicine never really worked for me the same way that it worked for the people around me. And so it really wasn't until I started playing golf and kind of went on a journey on my own. I went to University of Miami. I ended up in some medical anthropology classes. I was introduced to medicine from all around the world. And around the same time, I was really started to connect with my first mentor ever. And she was a mental health counselor. And when I started to work with her, she was the first, I would say it was the first introduction I had to effective care on some level.
To effective care?
Effective care, yes.
Can you talk a little bit, because you alluded to, or maybe you're going to get to it later, but I really want to hear what you were saying about that traditional medicine didn't work for you the way it worked for other people.
Absolutely. So growing up, and I'm not, I can go as deep into it as we want, but, I didn't grow up in necessarily the most amazing, picturesque white picket fence home, even though it very much looked like that on the outside. And I had a lot of health issues. We had a lot going on in our household in terms of, with my mom, with my ex-stepdad. I was in a divorce.
Dive into that a little bit. Share. I like to get nitty gritty with my listeners, because they need to hear your personal story to be inspired that they too can change their lives. I mean, to me, that's the gist of it, is how did you do it?
Yes.
Where did you come from?
Definitely. So, growing up, my mom was always very concerned about us and about the household we were into. And so she would take us to all of these counselors, all of these priests and psychologists and doctors. I struggled with a bunch of health issues. I had acne. I was exhausted all of the time. I had issues with allergies, all kinds of things. And I can definitely get into why I think that was, as we go through this. But really, I had never come out of a session in my life where I felt like, oh, wow, that was effective. That worked for me. And so I never necessarily put medicine or put mental health on some kind of pedestal because it just never had worked for me. Now, coming in, I grew up in Catholic school. I've always had, I feel like, a relationship. You can call it spirit, universe, life, whatever. I call it God. I feel like I've always prayed. And that's always been extraordinarily powerful to me. And I know growing up, I always just felt like everything, I saw things differently. I felt like some things were missing. I felt like I wasn't getting the full picture. So even coming into this world, I felt like I was born in search mode. I was completely born seeing things differently. And I'm sure everybody does. Everybody's unique. Everybody sees things differently. But
I don't think that's true, Brooke. I think you're not giving yourself credit right there, because a lot of people are not born in search mode. If people were all born in search mode, our world would be a different place. And maybe there's some essential characteristic there of openness that gets, slammed shut.
Absolutely. And I think, in general, I was born in search mode. I mean, I always felt like there's something more, and I just didn't know how to access it. And that was the worst pain of my entire life. And that's why when I had come across like chords of truth or things that just resonated with me, I grasped onto it because it was like, oh my goodness, this works. This is what I've been searching for. And so, being able to kind of like look back at childhood where there was a lot of fighting, a lot of trauma. My mom, had this interstitial cystitis before anyone really knew what it was. So even before I was born, she, had to go to the bathroom like 100 times a day. She had this crazy surgery that they don't even do anymore, but it really worked for her. And so I saw her really take the brunt of the pain, and I was just sitting there observing it as a child and seeing her in, very difficult marriage with, I won't go into that, but a very, very violent, very abusive relationship, seeing that and witnessing that firsthand and just feeling everything that you feel as a child going through that and, having to observe that, it definitely, makes you think about the world a little bit differently, right? And I've always been very much an observer. I always knew that there was something more. I always knew that I was going to find it, but it wasn't until I started playing golf just to get out of my house. I needed an outlet. I needed a way to, get out of the house that I was in. And so I decided to just get really good at school and really good at golf. And so I would go out.
So interesting. I mean, and my mind is just going and going about the similarities with other people that I've interviewed who had this burning desire to find the truth, even as children, and that, as traumatic as your childhood was, and the trauma that I'm sure that contributed to the allergies and the acne and all the things, is that trauma, even if you weren't being abused, which I don't know yet, but you were being abused because the environment is abusive. Mm-hmm. And I want to say that partly what comes to my mind immediately is this is why we get to change our whole society, is because even if you are not abused, as a child or an adult, there is so much of that energy in our society all around us all the time, these murders and, horrible experiences, that we are all experiencing secondhand trauma, at least secondhand trauma.
Absolutely. And when you come in sensitive, even a glance from someone that doesn't feel right can really affect you on a deep level. Yes. And so it's all about perspective, and absolutely. I mean, I came in sensitive. I could feel everything. I would have dreams about what was going on. I mean, I knew, even though you don't necessarily know, because, things can be covered up, you just know. And so I always knew. It was never, in the dark. I was very, very aware. And so, nothing really ever got by me. Now, I think the interesting thing that's really always pulled me through is that I've never seen myself as some kind of victim. I don't look at my patients as victims. I always knew that there was something in it. There was something for me. I was always an observer. I always tried to understand what was going on. And so I think that that's maybe one of the most empowering gifts that I'm able to give to my patients now, but also the most empowering gift I was ever able to give to myself, because when you're able to move through challenges and truly in your heart appreciate them and see that there's value and understanding and there's an essence and it can make you stronger and truly set you free.
Oh my God, that is so powerful. That is so powerful, Brooke. I mean, that is, I couldn't agree with you more, that the essence of having a happy life, the essence of it is being able to reframe the painful times into something useful for yourself.
Absolutely.
If you can do that, you can have a happy life. Period.
And I think it's actually, to be honest, the only way through trauma and the only way to clear the issues that come up, with challenges and in difficult times, is seeing it as for you. That's the out. That's the light. And I had to, that's why I think I never really related to conventional medical care, because it was all coping mechanisms. There was nothing clearing. There's nothing healing about it in it for me,
nothing empowering. I mean, I think that's the other part, is there's nothing empowering in traditional medicine. The whole paradigm of there is the healer, and then there you are as the receiver of the healing that they're offering. And there is no empowerment there. And I think that is a huge part of what's wrong with the medical system. And I think the medical system is realizing that now in some way, in that, there used to be no preventive medicine. Mm-hmm. There was no belief that the patient, quote unquote, patient, could do anything.
Yep. I never felt seen in the medical eye. I never felt understood, that it was really going to be useful. There's 3 events that really come to mind that really shaped, actually, I would say, there's so many stories I could give you. But there's a couple that I feel are so illuminating and just hit me in such a different way. One was, I had severe acne. Actually, it was interesting. I, was 14. I started to get it on my back when I was playing golf all of the time because I was sweating and obviously eating all the wrong foods in a contracted home environment, all of these different things. But I started to get it on my back and they couldn't figure it out. So we went through 14 different medications. Finally, I was on Accutane and it went from my back to my face. And so now I was stuck with it all over my face. And this was so interesting to me and so powerful. I remember I went to probably 12 to 14 different dermatologists to try to figure this out, because I didn't know there was another way. I didn't know I could change my diet. I didn't know that would impact my health. So I just was in search mode. I was always in trying to figure this out. I'm nothing's going to stop me. I'm finding a solution. I'm beyond determined and probably one of the most persistent people you'll ever meet.
Love that.
And so I would go through all these doctors, and I remember feeling that when they would talk to me, I just felt they would look at me and they would be oh, that looks so bad. And I remember having this one doctor, this was the best part of acne. He touched my face with his hands and he looked at me like I was a human being and he observed it, and he's conventional, it's just the person. I didn't realize the difference until that moment. And it was the most interesting thing I had ever experienced. And I was very aware of the difference. When he touched my face with his hands and he looked at me through an observational lens, I just felt, he goes, it's okay. Like, it's going to get better. We're going to figure this out. And that was just the medicine I needed. It was so powerful. And I just remember that difference between being judged and looked at like I was disgusting compared to that observation. And I kind of just internally was like, you know what? I'm bringing this with me forever. Like, this is something that I will be doing for everyone in my life, because I just felt the difference, you know?
But it isn't just that he was observing you. Yeah. He was connecting to you.
Exactly.
You know, you said he saw me as a human being, but it's like, it's the connection that healed you in that moment, and that you decided to take with you is the connection.
Oh, yes. I mean, I'll never, like, I can still feel it now, you know, just that feeling of him actually touching my face with his hands, it not being a sterile clinical environment where there was gloves and like they wanted to inject my face and throw medications at me. He touched my face, and I will just never forget that moment, you know?
Tenderness, caring, you know, it's, if there are a few things that all human beings require, you know, it reminds me of the failure to thrive syndrome. I don't know if you're familiar with that, where they did this study, this was, 80 years ago or something, where they noticed that babies in orphanages were dying, even though they didn't have any illnesses. Yep. They were just dying. And they realized after this study that they were dying because they weren't connected. Wow. They weren't being touched. They weren't being held. And it just makes me so sad to think of that. But it's like you in that situation with the acne, it's so difficult to feel hopeful and to want to live and to move on when everybody is treating you like that baby in the crib that no one sees them. No one sees you.
And that's, you know, there were a couple of other times that were just so illuminating to me. I went to this one psychiatrist, or it wasn't a psychiatrist, it was a psychologist. And it was right after I was dating this guy in high school, and he had just moved to college, and I was completely heartbroken. And it was the first time I ever asked my mom, because I never thought mental health was effective for me. And it was the first time I reached out and like, hey mom, like I would really like to see someone. And I mean, I never showed one shred of vulnerability in my life, probably until that point. I would only show kind of like distance, aloof. I was very withdrawn. I would observe. I would say, I'm not part of your circus. You know, I was very disconnected and
self-protective. Really, it was being self-protective.
Absolutely. And that was always my go-to coping mechanism, is distance, disconnecting, all of that. And so I remember coming to my mom and saying, look, I really, these feelings I cannot deny. And I went to this psychologist, and she was barely listening to me. And then at the end of the session, she said, maybe next time I'll have something that could be helpful for you. And I just remember leaving that appointment just knowing that, one, that was completely ineffective, or at least the way that was done. And two, I remember feeling like, is this all there is? But I knew it wasn't. And so I remember that moment feeling so it's hopeless, but I always knew there was more. So it wasn't like a full on hopelessness, because
discouraged, you know.
But I was just like, this is completely ineffective. Like this definitely doesn't work for me. And if it works for other people, great. But we are not in sync here, you know?
Well, I love that in one way, even as a very young person, you were able to discern between what worked and what didn't work. I mean, I think so many times people get into a therapeutic experience, whether it's with a therapist or a medical doctor, and they feel like they don't have a choice, that they just have to go along with it because they are the authority and they must know right. You know, they must know best. when it's all about whether that person's a match for you.
Absolutely. And it's
Very important, a very important connection. I'm sure you feel that all the time with your own patients, is people come to you and I know they have that experience, that you are connecting to them, that you are seeing them. And, that's what we're craving.
Absolutely. Just to be seen for who we are. And I recall that one, experience where, you're obviously not seen, but, and that just obviously goes back to the work that different practitioners, do with themselves. And you can really only take someone as deep as you're willing to go. But
another nugget, guys, really listen to this. If your medical practitioner or therapist is not doing their own work, then they don't have that much to offer you. I love that.
100%. It's, it's so, you just go deeper and deeper and deeper. And something like being present can mean one thing, 10 years ago, and a completely different thing now. But those fundamentals and things that are just true, you just draw from, you deepen into, it becomes expansive. You see it differently all of the time. And it's just tried and true, So
I'd like you to segue into how health and growth are an integrated process.
Absolutely. So
because you set the stage for us, you've set the stage for us in your own experience. This is what you were looking for, right? This is it.
Yep. And because I had health issues, and then I think, what I was searching for is how to grow, right? How to actually go within. When someone's in search mode, they're looking at all the shiny objects. They're searching without. They're looking at, all of the medications, all of the supplements, the diet, all of these, the practitioners, the books. They're in search mode. They know there's something more. They feel that there's something missing. And all I see it as is they just need the fundamentals to realize, how can I actualize? How can I go within myself? How can I see myself differently? And how can I bring in tools that, lessen the fallback point and allow me to keep moving forward without falling back into that recirculated cycle? And so I see health as a way to support growth. And I also see it very much as a figure 8, where they each support one another. If you're not growing, there's going to be stagnation. There's going to be issues physiologically. It's difficult to learn new things, to be able to observe your symptoms and to move through them and learn from them in a very receptive way. And if the health piece isn't there, it's going to be difficult. You're not going to, it's going to kind of get in the way and sabotage growth, because it's just a missing link. We have to learn how to send our body signals of safety and how to bring in supportive mechanisms to kind of get us, make it easier to be clear,
So how did you, let's skip forward from the ineffective psychologist to how you got into the field and how you have come to set the stage for this integration of growth and health. I mean, the education you got in psychology and medical anthropology and Eastern and Western medicine, that's a lot of education.
Yeah, I mean, there were definitely moments that struck chords in that environment, especially experientially, things just relayed by different professors and doctors and whatnot. But I, met my first mentor when I was really going through something my sophomore year of college. I came in last in a golf tournament. And anyways, it ended up being one of those things that just really ended up being the best thing on earth. But I switched my major to medical anthropology, to psychology, and I had already almost majored in psychology. I just wasn't aware of it. And I met my first mentor at that time. And that's when she started to teach. She saw me for who I was for the very first time. She cut through all the noise. She saw me. She directly could see what was going on. And I hadn't cried maybe in like 20 years. And I broke down, and it felt so good. And it was just like, oh my gosh, I found what I'm looking for. And then I just could hear it more and more and more. But in medical anthropology and, going through my education, I just have always been a self-experimenter. I try all kinds of things, to my demise at times, but it's fun.
Yeah.
And so, there's just certain things that are just tried and true with diet, with mindset, with lifestyle. And so in my practice, the first 4 to 8 months with a patient, I am highly focused on the fundamentals, because someone may come in and say, oh, I'm eating so healthy, or I'm sleeping, trying to sleep well, but maybe they're actually not, and are you, doing this in a way that truly works, that can be realistic and sustainable, where you can live your life and you don't have to isolate. For example, a lot of people, if they're on a specific diet or if they're working with a health thing, they'll often isolate. So how can we connect and have the best of both worlds? We don't have to sacrifice. We didn't come in here into this life to compromise. That's not interesting at all,
Do you support the idea that there are different diets or food plans that support different people? I mean, that it's really a unique thing, that there is no one size fits all?
I think there are some universal truths to mindset, diet, lifestyle, but I definitely think everybody is unique. Everything has to be personalized, because otherwise it's not internalized experientially. You know what I mean? And I also think there's a lot of value to, eating things that are not good for our bodies, or because we are able to then see the symptoms, and it makes it easier to change moving forward. And so I try to, basically my whole goal as a practitioner is to, one, give people a direct process to health and to growth, to teach them exactly how to go within, exactly how to understand their minds, bodies, hearts, lives, but primarily in the context of healing mode, to shift them into a healing mode where maybe they're used to being stagnant and plateaued and maybe regressing, shifting that to a healing mode. Now we're just moving forward. Your fallback point has now changed. And that's, it often doesn't always take that much, but if we keep putting energy back into the system through, for example, looking at life as to us, through, and then changing that to for us. Well, that's more expansive. That's more interesting. Okay, tick. We're closer to healing mode. Okay, how can we support sleep? Okay, we resolve sleep. We deepen that. We work on diet. Okay, now we're in healing mode, and this can keep growing, and we can keep accelerating by focusing on connecting, getting present, and continually focusing on what we can do, what isn't working, what is,
Do you ascribe to the idea that sugar is something that is bad for us?
So, different sugars have different impacts on the body. So, for example, honey, raw unfiltered honey can be extraordinarily beneficial, whereas if it's processed, if it's chemically laden, stripped of all nutrients, it's probably, not going to support health.
Yeah. Okay. That's something that came to my awareness, 30 years ago, really, before it was a thing.
Yep.
Was the incredibly destructive aspects of sugar and how our society is so addicted to it. And we could talk the whole thing about all the way that greed has gotten involved in the food industry, and people, the companies don't care whether their products support health or not.
And that, I think is just another facet and way for people to go within, right? They are now not, relying on big food the way that they once did, or their doctors. They're looking within for solutions. They're searching on Google. I love Google. Are you kidding me? I think it's incredible that people have access to information at their fingertips that can help them, And so I think that on some level, the conventional system that is highly broken, that is highly toxic, can be the most powerful driver for health and growth. And so in the weirdest way, I think we kind of, can look at that and really just kind of thank it,
Well, I agree with you in a generic kind of way. That whole idea that there is a big daddy authority that knows better than we do that whole idea gets to crumble. And the way, so yes, them saying, buy this, drink this, eat this, and us eventually learning to say, you know what, that's crazy.
Yeah,
that's
absolutely
just crazy.
And guess what? Then people are up in arms. People will never forget it. Now they know the truth. They're feeling better. They know that health isn't that complicated. And so it's just maybe one of the most empowering experiences that anyone could ever have. And the thing is all of this stuff that's based on lies and coercion and driven by finances, it will crumble. I mean, I have no doubt in my mind, nobody is going to want to buy it. It's not really that healthy. You can buy chocolate, you can buy pancakes, you can buy ice cream now, all of the stereotypical coping mechanisms organically, without gluten, without dairy, even without sugar a lot of times. And so what are people, when this starts to continue to grow, even for those those kind of like fun choices or maybe not completely health supporting choices, people are going to continue to buy the things that don't make them feel sick and that don't create addiction over here. That's actually one of the first changes, just tactically, practically, I'll make with my patients is, if you're used to eating all of these boxed and processed foods, okay, now let's just shift it to a healthier version, optimize the quality, so at least the addiction is stripped, and then we can work from there. Then we'll continue to optimize, bring in anti-inflammatory, nutrient-dense whole foods from there. But it's a process, it's a journey, and I think that, people are just going to keep going more and more this way.
When you talk about growth, can you talk about that a little bit in terms of what you think of as growth and how people can keep engaged in the process of growth?
So I think, I see it as very much this. There's you, right? And then there's your perception, your thoughts, feelings, physiology, and life experiences, relationships included in all of this, how we relate to ourselves, how we relate to other people. But I think, when it comes to growth, I call it let go and grow, right? I kind of think about how can we engage in this process. There's certain fundamentals that are extraordinarily important. So for example, we must be able to learn how to connect to our hearts, because I think that gives us just enough space to interact with our thoughts and our feelings differently. We have to work with thoughts different than we work with feelings. Thoughts need to be disciplined. We need to be the ones to change them, whereas feelings often just need to be felt, right? Physiology, it's more evolutionary. How can we support our body? What are our bodies, programmed to relate to? Life experiences, how can we begin to bring in a perspective that creates healing 24/7? Perception is medicine, and there's a lot of research to support that, but it's 24/7 medicine. And so I always begin with teaching my patients who, what, and where they are. Who you are is the creator of your reality, simply because you have the power to choose. You have the power to choose how you perceive, how you interact with, how you interpret different life experiences. So you always have options. You always have choices. And the question becomes, what feels expansive? What feels healing? How can you clear? Versus what's creating distress and contraction. Now, there's obviously, I see kind of like this contracted state as untapped potential, because it's what is broken. You are not broken. You're perfect, whole, and complete. But there's patterns that are just broken, and there are patterns that just don't work. And so let's look at that. Let's decide, let me look at that by getting, by connecting, by getting present, turning the light on, right? And let's look at this with a receptivity to learning from it. The second we learn what we need to learn, we let go of it, it lets go of us, growth ensues. But growth is always the driver. And so in a nutshell, there's a lot more to it, because we have to free up our power to choose, which is the magic. We have this power of choice, this ability to choose. We can obviously create any reality, any life experience that we're interested in creating, but we have to free up that power to choose. And of course, there are issues involved in that. And there's perspectives and thoughts and feelings and all these experiences that may not work. And so we have to detoxify that. We have to release that resistance so we can focus on who and what is coming up and what we can do moving forward.
Whew. Amen, sister. I mean, I'm sitting over here laughing because you are such a ball of energy. I mean, such a little firecracker
Oh
and
my gosh.
so passionate about what you're
I'm obsessed with what I do. I mean, it's like I found it. I was in search mode. I found it, and I will never let it go.
Well, and that is so beautiful. I love that, and I hope everyone can find that similar purpose. A couple of things I wanted to ask you about and to comment on about what you just said. One of the things as an intuitive counselor and licensed therapist for 35 years, one of the things that I believe, that I've come to believe, is about that integration of paying attention to body, mind, and spirit, to the mental, to the heart, to the body, and to our intuition, which I think of as our connection to God or spirit, however. But you were saying that the feelings just need to be felt. And I agree with that. And I want to add that they also get to be disciplined, like our mental process, because I have had many, many clients over the years who they have gotten out of their mental process and they are completely dominated by their emotional experience. Yeah, and that's not, I just want to underscore that is no more healthy than being stuck in your mental process,
Absolutely.
that you in your body, mind, spirit integration. I just want to underscore that and make sure people understand that point. That self-mastery is all about noticing what you are thinking, what you're feeling, what you're experiencing in your body, noticing it, and yet still what you were saying about the whole being, nurturing and strengthening the whole being so that you can be neutral and notice, wow, I notice I'm thinking about killing my husband. I wonder what that means, without judgment.
Yes. Yes.
And the same thing about feelings, I want to kill, I feel like I want to strangle him right now, to say, okay, I wonder what that's about.
Yes. And we have to take that step back and remember that we're not our thoughts, we're not our feelings. And because of that, we can change them, and of course, the ego has a big role in it as well, right? Like, how does the ego influence our thoughts and feelings? And I think that, understanding its MO to divide and conquer, and that it's purely a survival mechanism, that recognizes, oh, look, Helen, oh, look, Brooke, you have a pulse. Keep staying exactly where you are. Don't change. We're going to do everything we can to resist change. And so paying attention to how that infiltrates thoughts and feelings, and then bringing that to the patient's awareness so that they can change and that they have another option. When it's in our awareness, so often, what's so interesting to me is most of my patients come in really believing that awareness is a curse because they're so sensitive. They see so much. They see so many symptoms. But I say, look, I get it because I thought it was a curse probably for a while too, subconsciously. But what if it's a gift? What if it means that things are processing out and through, and that, by turning on the light, you just have more options. So I think
I love the inclusion of the ego into the conversation, because obviously as a therapist, I work with that all the time.
Yes.
And the mistaken belief we have is that the ego cares about us and is guiding us in a way that is going to be for our best interest. And the truth is the ego does not care. This is the weird paradox. The ego does not care if it kills us, as long as it protects our identity as an individual.
Yeah, absolutely. I think, the thing about the ego is that, there's alarm bells everywhere with it. It just is threatened by everything and everyone. And so it's a protective mechanism. It flares up. It divides us from new experiences. It wants to divide us from change. And I actually think understanding the ego and having awareness around how it works may be one of the biggest internal ways to grow, is when you're able to see that challenge, see how it's dividing you, and choose to connect anyways, choose to do what you want with your life anyways.
I love that. I had a post on Instagram exactly like that said, you can hear what the ego says and just do it anyway.
Yes.
Just do it anyway. I want to go back to something else you said, which I have kind of mixed experience with the idea that we create our own reality. I am all about it's happening for me, and I get to have a powerful intention to, to do whatever it is that's expansive for me. And I think that we get to be careful as practitioners, as healers, in saying that you create your own reality 100%, because I think then when it doesn't happen, excuse me, whatever they're intending doesn't happen, then they can interpret that as I'm bad.
Yep.
I didn't try hard enough. I interpreted something wrong or whatever, when we don't really know what their destiny is. We can encourage them and support them in their intentions. But let's say it's to have a life partner. They may or may not get a life partner, no matter how much they intend to do it. And yeah, maybe if they could do everything perfectly in order to set that up and they had no blocks at all or whatever. But I just want to, how do you handle that, in your paradigm and in reality?
Absolutely. So I think you have to always work with who and what is showing up. And the epitome of non-judgment observation is knowing that it's actually all okay. It's okay if something traumatic happens. It's not that you have to like it or condone it or recreate it, but it's obviously showing up in your world. There's an essence to it. So we have to address it. Now, the flip side to that is if you don't, decide to see it that way, then you'll always be divided and it'll be very difficult to move through. So I vet, and I buffer. We create our own realities because we have the power to choose how we perceive, how we interpret, and how we interact with our life experiences. I don't think we're consciously and intentionally creating every little thing that comes up, but I do think that it all is a pivotal piece of the growth process. And so if we're not judging, we're now able to relate and to allow it to bring us to where we want to be. And so I think a lot of times when, people get obsessed with manifestation and they're like, why isn't this working? Well, I think it's time that you begin to let go of expectations. It's time to learn how to get into the present moment. It's time to let go of fixation, which narrows your field of vision, and and anchor into faith where the process can work for and with you. Okay, that relationship ended. Guess what? Maybe that was life protecting you. Maybe there's someone else for you. Maybe you still have work to do in it of yourself. And maybe all of the pain that you're feeling is just that way to the other side. Maybe it is the medicine,
I love that, because what I hear you saying is that the reality that we create is our own interpretation of whatever happens.
Absolutely.
That's we create our own reality because we create our own reaction to whatever happens. I may desperately want to have a baby and feel like if I do this and that and, meditate on it and do a mantra every day and blah, 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 that's going to happen. Well, that's not really, from my paradigm, it's not really up to us completely. Our intention matters, but the universe has a big say in it too.
Absolutely.
And so whatever happens, if I don't have a baby, I get to create my own reality by saying there is some reason I wasn't supposed to have a baby, for instance. And, and I wonder what I'm being guided to do. Am I being guided to work with other people's children? What is it that I'm being guided to do? Then it's like I can make friends with reality and I can love my reality, whether it looks like the one I, quote unquote, like you said, expected or not. And I feel like this is the big flaw in the whole manifestation thing, which I love how you just nailed that about, we have to be aware of narrowing our intentions.
Well, I think too, exactly. And I think too, it's about faith, right? The mind is so limited. It really is. And people obsess about the mind and the brain and all this stuff. And that's great. It's useful, obviously.
Yeah.
But it's not the end all be all. There's something far more in store. And it's important to learn, so much of, personal growth and manifestation, despite what people say, my experience is that so much of it is based on fear and control and trying to fixate and, manipulate things. If you're actually going to expand into your life, you have to focus on who and what is coming up and what you can do. Keep it simple. If you're obsessing about this baby in the future, guess what? This experience will never work for you. It will always feel fear-based and based on outcome. And once you have that child, there will be the same exact pattern will just be brought somewhere else. So that's where it's all about essence and intention. And what I love about intention is that you can have freedom. You can care and nurture and love people with or without a child. And by expanding into the experience, being inquisitive, curious as you're going through IVF or searching for different solutions, by having an expansive, fulfilled vibe going into it, and certainly knowing that everything is happening exactly as it's meant to, that gives you better chances at getting what you want anyways. It actually accelerates the process.
Because relaxation allows you to connect to yourself, allows you to connect to the universe, and then you are open. Yeah. I mean, that's how I interpret it.
And it's more fun.
We could talk all day. I feel honestly like we just got started, and I would love to have you back on the show because I know you have so much more to say.
I'd love to come back. This is fun.
Good. So before we close, I would really like you to summarize, in a couple of real takeaway points for the listeners. And then after that, I want you to talk about things you have upcoming, how people can contact you, because I just know that some of the listeners are going to be turned on to what you're saying, and they're going to want you as their practitioner, and you can do it over the internet, right?
Absolutely.
So give us a couple of takeaways and then tell us how.
I think, one of the biggest messages that has been coming to me recently is that you can own the darkness by turning on the light, and you have the power to connect and to turn on that light, right? I think one of the other messages, let's say I'm giving 3, is that you don't have to cope. You can actually clear and heal. And that's something that was what I was searching for, and something that I see, even just bringing in that possibility, I can see the relief in my patient's eyes that, oh, okay, we've got this. We can clear issues. I don't just have to compromise, struggle, and cope with them. And I think third is just knowing that you already have everything within you, and just setting the intention and that focus on, okay, I am, set for growth. I'm set for healing. Like, that's my intention. And then bringing it back into the present moment and just focusing on your experiences, what you can do on a consistent basis. That's your commitment, intention, commitment. You know what I mean? Yes. That will inevitably move you forward. And so I guess if I had to kind of summarize, those would be the 3 things that first come to mind.
I got to say something about one of those before you talk about how to contact you, and that is the difference between coping and healing. Mm-hmm. I have a video about that. I don't know if I did a podcast on it, but I have a video on my YouTube channel about that, because our society is obsessed with coping.
Yes.
And, it's so destructive, because it just encourages us to cover things up and just, make your way through the day without any expectation that you can actually heal it. And I'm talking about whether, you don't like oral sex because you were traumatized as a child, and so you just eliminate oral sex from your life. That's coping.
I think too as well. And I think too as well, coping has its place, right? We all need a Band-Aid on some level at some points, but it just doesn't always work long term. And I think that, if you look at the definition,
ever work long term.
It's if you look at the definition of coping, it means layering over a brick wall. So I kind of see it as, how can you move through that, right? you kind of can't because you keep building on it. But the other thing, that's so interesting about coping is, it doesn't allow for the space to want what you want and own that, because nobody wants to truly, if they get real with themselves, it's very difficult to, to settle and to feel good about it.
Absolutely. It doesn't feel good to settle. I love that. So tell us how to contact you and what you've got coming up.
Absolutely. So you can contact me through my website. It's drbrookestuart.com, DRBROOKESTUART.com. We have all the information on the Let Go and Grow program on my private practice over there. We love Instagram. It's just at Dr. Brooke Stuart. And those would be the ways. Feel free to reach out. We're very responsive, and it's so much fun connecting with everyone. Absolutely. So
Awesome.
Just feel free.
Good. And even if you just have a question, please contact Brooke. She can support you with that question, whether you become her patient right now or not. Again, it's all about connection. Yeah. And I know that you're on this show today because you want to give.
Oh, 100%. Thank you for having me. I mean, exactly. I have it right here. I went to Tony Robbins' Unleash the Power Within, and he said a quote, "This life is the gift that has been given to us, and what we choose to do with it do with this life is the gift I can give back, or we can give back." I changed it from, us to we to I to me, because I just think it's so powerful. We've been given this life, and what we choose to do with it is the gift we can give back. And so anytime I have the opportunity to do something like this, I love it. So thank you so much for having me.
I'm so glad you came. And I want to just underscore that for the listeners, that everyone has gifts to give the world. And I think that's one of the things that you light up in your patients, is that you can make a difference. And it starts with making a difference in your own life, and then it flows out to others. And of course, that's exactly what I support my clients about is, you have gifts, and you get to see yourself as a gift. And then give that gift to others. And so thank you so much for coming today. I love you. I honor you. I respect what you're doing. And I would love to have you back, and all the best. Thank you so much, Helen. Well, you're welcome. My pleasure. And thank you to the audience. I love you too. And I will talk to you next week. Bye, guys.